I'm here to present the data on the ibrutinib plus venetoclax combination. So this is, as we know, ibrutinib and venetoclax are both really exciting new drugs in low-grade B-cell diseases. The disease that we actually tested was actually mantle cell lymphoma in relapse. And we know that ibrutinib and venetoclax individually can produce around a 20% complete remission rate and about 12-month remission in mantle cell lymphoma. So the question for us really was, if you combine the two drugs together, can you get deeper responses and better responses? So we undertook a phase 2 study where patients took essentially the full dose of ibrutinib for 1 month, and then after 1 month they took ibrutinib in combination with venetoclax at the full clinical doses and on an ongoing basis. And it's a phase 2 study done at Peter MacCallum and the Royal Melbourne Hospital. We recruited 24 patients. The patients have been fully recruited. The primary endpoint is the response rate at 4 months, and all the patients are now evaluable for the primary endpoint. And the long and the short of it is that the combination is quite tolerable, so there were no unusual or unexpected side effects. We did see 2 patients who had tumor lysis syndrome. These are patients who had very large burden lymphoma, which actually got worse during ibrutinib. So they were not surprising that they did get some evidence of tumor lysis syndrome during venetoclax ramp-up. However, both patients got through the tumor lysis syndrome. Both patients then went on to full dose venetoclax without any issues. And at the moment, our results show that there's a complete remission rate of 63%, which is substantially higher than 20% expected for the individual drugs. But probably more important for us is the quality of the responses. So these are complete remission by PET scan and by endoscopy with biopsies. But we also did the bone marrow, and we also did bone marrow with minimal residual disease testing. And most of these patients, 77%, are negative on MRD testing at about the 10 to the 3 to 10 to the 4 type resolution. So really, we're getting very deep responses, a high complete remission rate. Obviously, with a study that's only got a median follow-up of around 9 months, what we need to see is a more durable response and an impact on the long-term outlook. But for a group of patients who really had no other treatment options where chemotherapy had failed, we really think that our results are very promising. And based on these results, the Pharmacyclics have now started a phase 3 study comparing ibrutinib by itself versus this combination in patients with relapsed mantle cell lymphoma, and that the study design will also be presented in Lugano as an oral presentation as a trials in progress study.